Hello and welcome to another video in Foundations of Maternal and Newborn Health. In today's video, we're going to be talking about teratogens and specifically teratogenic infections. So we talk about teratogens in the pharmacology unit. Just as a reminder, teratogens are anything that cause birth defects. And so there are a lot of potential causes for birth defects. We talk about drugs in the pharmacology section, like I mentioned. Of course, we're talking about infections today. But there are also other causes like malnutrition. And then there are also environmental factors, like radiation, which we won't really touch on. Radiation. So drugs, infection, and nutrition, these are all factors that we can kind of more so control. Research suggests plays a bigger role in causing birth defects. So again, today we're going to be focusing on infections, and there's an acronym that's commonly used for teratogenic infections, and that acronym is TORCH. So I actually don't really like this acronym, and that's because the O in TORCH stands for other. So these are other infections, and we'll go through what those other infections are in a minute. But the T in TORCHes stands for toxoplasmosis. And so we've talked about toxoplasmosis before. And you want to be worried about toxoplasmosis during pregnancy because it causes birth defects. And so it targets the brain of the fetus, facial features or facial development, as well as the heart, other things as well. So if a baby develops toxoplasmosis, or a fetus, an unborn fetus develops toxoplasmosis, they developed birth defects all over their body. We'll go over the other illnesses. The R stands for rubella. So this is similar to measles in, young infants usually get it, and you get quite a red rash. But if a pregnant mother gets it or a fetus develops it, similar to toxoplasmosis, it causes issues with brain development, heart development, and specifically hearing as well. So the newborn's usually deaf if they get rubella during pregnancy. The C stands for cytomegalovirus. And this is usually abbreviated to CMV. And CMV really targets the brain, so this causes a lot of congenital abnormalities of the brain. H stands for herpes simplex virus, so this is just herpes simplex virus, and this also causes brain abnormalities as well. So the other illnesses are syphilis. So syphilis, HIV is another one that causes birth defects. We also have an illness called parvovirus, and this is also known as erythema. We also have varicella zoster. So this is chickenpox. So you've probably heard of chickenpox. And this is caused by varicella zoster. And then lastly, we have hepatitis B. Okay, so we're just going to go through how you develop each of these and possible ways to avoid them, and then possible ways to treat them if you do get exposed or you do develop some of these illnesses. So toxoplasmosis usually comes from food, specifically meat. And it can also come from owning cats as pets as well. So this is usually how you get toxo. Rubella and cytomegalovirus, these are respiratory. So that means they come from, coughing, laughing, talking. You kind of spray droplets of virus whenever you talk or laugh, or comes out of your lungs. So this is kind of comes out of your lungs. And parvovirus and chickenpox are also considered respiratory as well. Herpes, syphilis, and HIV, these of course are all STIs or STDs. And then hepatitis B is a bit of a weird one. This one's blood to blood. So you have to kind of be in contact with a sick person's blood. So when it comes to avoiding getting these illnesses during pregnancy, there's a few things that you can avoid. Of course, whale meat is notoriously contaminated with toxoplasmosis. So freezing your meat, of course, is important for toxo, especially for a pregnant mother. STIs, of course, you're thinking condoms. And then when it comes to respiratory illnesses, there's not much that you can do. The best you can do is avoid sick individuals, so avoid sick people. And then more commonly with COVID, a lot more people are wearing masks. And so masks can also help prevent respiratory illnesses from transmitting. The other big one is vaccines. So rubella, varicella, and hepatitis B all have vaccines available. But unfortunately, chickenpox or varicella zoster, as well as rubella, these are unfortunately live vaccines. This one's also a live vaccine. And what that means is that the vaccine is actually just a weak version of this virus. And so can actually make you sick. Now, this virus isn't as strong. The virus in the vaccine isn't as strong as the illness itself, but you do have to weigh risk versus reward of giving the vaccine or developing the illness, which can cause severe birth defects. Right, so the key takeaways here are firstly to get vaccinated. Ideally before getting pregnant. So before pregnancy. So to get vaccinated. The second is really just to avoid sick people. And this also includes things like good hand hygiene. So, pregnant mothers should really be washing their hands regularly and practicing good hand hygiene. Of course, condoms are good for preventing STIs. So these are all prevention mechanisms. So these are all for prevention. So these are all prevention. Lastly, I just wanted to talk about potential treatments. So there's really not too much that can be done if you develop any of these illnesses during pregnancy, unfortunately. So you really want to prevent getting the illness. But there are some things that can be done for certain diseases. So chickenpox, for example, if the mother has been exposed, so the mother hasn't actually developed the illness yet, but maybe she goes somewhere and there are kids playing who have chicken pox. She doesn't realize it, but then she figures it out, or she's told. Then she can go to the hospital and get something called IVIG, and this stands for intravenous, and the IG stands for immunoglobulin. So if you remember back to our intro to immunology and antibody lectures, immunoglobulins are antibodies, and these can help protect from developing the illness in the first place. So this only really works with varicella. So if a mother has never gotten chickenpox before and she's exposed, she can go to the hospital to get IVIG. If the mother has herpes and she actually has an outbreak during pregnancy or during labor, you can give antivirals, and specifically acyclovir. And what this does is it just reduces some of the herpes that is present in the mother, and it helps protect or reduce the chance of giving it to baby. For syphilis, you give antibiotics, and if you have watched the teratogenic drugs video, you do know that some antibiotics can cause birth defects, and so you should be giving penicillin if possible. So penicillin does not cause birth defects, and so that'll treat the syphilis and won't cause birth defects. Some people are allergic to penicillin, and so you can give clindamycin. If the mother is allergic or if there's a drug-resistant strain of syphilis. So this is a bit of a long video, but the takeaways here are to really prevent getting any of these illnesses, because there really aren't that many treatment options if a pregnant mother does develop any of these illnesses. And if the mother does develop any of these illnesses, the birth defects can be quite debilitating.